Well, my name is Lee Francis. I'm a physician by training. I'm currently the president and CEO of Erie Family Health Center. And Erie Family Health Center is a federally qualified health center that has existed for 52 years, serving the west and northwest sides of Chicago, serving people regardless of their ability to pay. We currently serve 30,000 patients from all walks of life, insured, uninsured, Medicaid, Medicare, self-pay. Our mission is to really treat health care as a right rather than a privilege. One of the things I'd like to add is in terms of patients who think they're insured and still don't have access to the full range of health care that they might need. And I'm thinking even here in the state of Illinois, patients who are insured by Medicaid, which is our state-funded cooperation between the state and the federal government. Some patients with Medicaid are not accepted at certain health providers within our city of Chicago and the state of Illinois. So they may have less options than you might think, even though they have a valid insurance card in their pocket. I think two-tiered health care like that is something that we need to move away from. And I'm hoping that our health care reform will address that issue as well as addressing the needs of the uninsured as well. Regarding prevention, there's no doubt that preventing an illness or curing it in an early stage is much less expensive than expensive hospital days, intensive care unit days, draining the resources of our healthcare system. I think we have ample evidence now that our healthcare system costs are rising so rapidly that we have to do something to control cost. In my mind, one of the best ways to control cost is to invest in primary care, not only in primary care facilities and procedures such as screenings for cancer, such as mammograms, but also in the primary care workforce to train those physicians, nurse practitioners, physician's assistants, nurses, medical assistants, and the entire pipeline of healthcare so that we can address the needs of primary care. I think we'll find out that if we do have healthcare reform that's successful in the United States, that the demand for primary care will go up. And I'm concerned that we do not understand all the capacity issues at this time to handle the increased need for primary care. What I see going on now nationally in Washington, D.C. is a struggle over whether, to put it nicely, whether people are going to still fall through the cracks or not in our healthcare system. And I think without a publicly funded and publicly managed system, that there will always be people that fall through the cracks. I think the track record of our current system is that over 45 million, some say 47 million people are falling through the cracks. And those are just the ones that we're counting. And so I'm concerned that if we don't have a publicly funded system, that there will be many, many people who fall through the cracks. And since healthcare is a right, not a privilege, I think that's something that we can't afford to let happen.